Hi Bob, my name is Sarah. I'm going to be your nurse today. So I'm going to wash my hands and provide for privacy as I enter the room. So today we're going to be just changing the dressing on your chest tube site. So we'll just be taking off the old tape and the old gauze underneath and just replacing it with new stuff and cleaning the site. It shouldn't hurt. It might be a little tender, but it shouldn't hurt, and it should be a really quick dressing change. Do you have any questions or concerns? And he says he doesn't. Do you think you'll be able to sit fairly still for this? And he says, yeah, he said they've been changing it a couple times the past few days and he's used to it, so he is good to go. Can I have you state your first and last name and date of birth? And he does, and that matches my records. Do you have any allergies? Any iodine or any cleansing solutions that you know of? And he says no, he doesn't have any allergies, so I can go ahead and get started. So I'll wash my hands. I have all my supplies. I have my 2 drain sponges, my cleaning applicators, my petroleum dressing, my ABD pad, my sterile gloves, my tape, and so we should be good to go. So I have my cleansing solution, and I'll check the expiration date, and that is not expired, so we're good there. So I'll pour some. And then with my applicators, I can touch the ends as long as I'm not touching the tips, and then I'll throw those away. So then I'll put on my clean gloves. And then I'll begin to remove the dressing. So I'll anchor it as I pull the tape toward the insertion site so that I don't dislodge it. So then on the old dressing, I'll know any drainage, color, odor, consistency, anything I see there, and I'll put it in the biohazard bag, and then I'll take off my other part. I'll palpate the skin around for any crepitus, and if I did see any, which I don't feel any right now, I would want to mark it so that I know next time if it's spreading at all. Are you having any pain or discomfort at all? And he says no. Okay, so then I'll take off my old gloves, wash my hands again, and then I will put on new clean gloves so that I can clean the area. So using a no-touch technique, I'll clean the area with my applicators, just getting any extra drainage off, noting any, like I said, swelling, redness, or any other drainage that's around the site, and it looks really good. So, take off my gloves. I can put this to the side now. Don't need that anymore. Wash my hands again, and then I'll open up all my sponges just so I have them ready. Keeping them sterile, only touching the edges. And then I'll put on my sterile gloves. Wash my hands. Okay, so now I'm going to grab my petroleum dressing. And I'm going to have to roll that. And I'm being careful not to turn my back to my sterile field. So I'm going to use one hand, I'm going to make it clean instead of sterile. And then I'm going to anchor the tube just so as I'm changing the dressing I don't dislodge anything. So make sure that's around there nice and good. And then I'm going to take the first pad and I'm going to put it on top. Take the second pad, again not crossing over any of my other pads. Put it on the bottom. And then I'm going to take my ABD pad, and put it over top. So now that that is covered, I can get my tape ready, and I don't have anything over here anymore, so I can get rid of all of this into the garbage. And then, using a no-touch technique, I'll just touch the ends and I'll put 3 pieces of tape over the insertion site. And this would stick better to a real person. So I have my third piece here, again using the no-touch technique. And then I would make sure the client's doing okay. Are you doing okay? Are you feeling any discomfort? He says no. Get rid of my gloves, wash my hands. And then I would mark with a piece of tape. I'd write my initials, the date and time it was changed, and I'd put that on the dressing. I would make sure the client was possibly in semi-foulers to promote drainage, unless it was ordered not to do so. Again, during this whole procedure, I was keeping the client as covered as I could, making sure not to expose them too much. I would document the time and the dressing change, the date and time, any drainage I noted, any other characteristics such as crepitus or anything else. I would make sure the patient is comfortable, and then that's all.